Good afternoon, ladies and gentlemen. Imagine this. You go home for Thanksgiving dinner when you glance across the table and you see your father grip his chest and fall to the floor. Would you know what to do? Would you know that he possibly could have experienced a heart attack? If the answer is no to these questions, you're not alone. Although cardiopulmonary resuscitation has been around since 1740, the American Heart Association states that 70% of all Americans feel helpless during a cardiac emergency due to the fact that they have not had adequate training in CPR, or the training that they do have has greatly lapsed. I myself have been BLS certified since 2010. I know how to properly perform CPR on infants, children, and adults. And I feel inspired to share this information with you. So today I'll be discussing the history behind CPR and how to properly perform CPR on infants, children, and adults. Now that you know what I'll be discussing, let's jump right into it. In 1740, the Paris Academy of Science first recommended mouth-to-mouth resuscitation on drowning victims. In 1891, Dr. Frederick Mass performed the first chest compressions on a human. In 1903, Dr. Krill reported the first successful external chest compressions on a human. In 1957, the United States military adopted mouth-to-mouth resuscitation in unresponsive victims. In 1960, cardiopulmonary resuscitation was developed, and the American Heart Association developed a program to properly train physicians with closed chest cardiac resuscitation, and it became the fourth runner of CPR training to the general population. In 1966, the National Research Council of the National Science held conferences on CPR. In 1972, Leonard Cobb held the world's first mass CPR training in Seattle, Washington. He trained 100,000 individuals in the first 2 weeks of this course, called Medic 2. In 1983, the American Heart Association held a conference on developing a pediatric resuscitation guideline. In 1988, the American Heart Association introduced the first pediatric course and the first neonatal resuscitation guidelines. In 2004, the American Heart Association first recognized the use of an AED in children 1 to 8 years old that showed no signs of circulation. In 2008, the American Heart Association released a statement about hands-only CPR and stated that bystanders who witnessed the sudden collapse of an adult should dial 911 and provide high-quality chest compressions, giving chest compressions hard and fast. Now that you know the history behind CPR, let's get started in telling you how to perform CPR. In an infant, the very first thing you want to do is you want to check that you yourself are safe and that the victim are safe. You want to then evaluate, does this infant need CPR? You're then going to check responses. You're going to turn the infant upside down, chest, and hold them kind of like this, pat their back, check for a response. If no response, you're going to then turn them over, lay them flat. You're going to check for breathing. The way you check for breathing is you're going to look, you're going to listen, and you're going to feel. Once you check for circulation, response, and their breathing, you're then going to give 30 chest compressions at a rate of 100 compressions per minute. You're going to use a 2 or 3 finger technique along their nipple line, and you are going to press down approximately 1/3 of the depth of the chest, so not very far. After giving 30 chest compressions, you're then going to open the airway and you're going to give 2 rescue breaths. You are going to give 1 breath after the other. You should see the infant's chest rise and fall, rise and fall. Once you've done all of these things, you are going to repeat until help arrives. Now that you know how to properly give CPR to an infant, let's talk about how to give CPR to a child and an adult. A child is anyone 1 year and older. You're going to, again, first check the safety of you yourself, the rescuer, and the victim. You are then going to assess the need for CPR. Check for a response. Tap the child or adult on the shoulder, shake them, try to get them to verbally respond to you. If they do not, you are going to then check for breathing. You're going to, again, look, listen, and feel. Once you look, listen, and feel, and you know that you need to give chest compressions, you are going to, again, give chest compressions, 30 chest compressions, but this time you're going to push hard and push fast at a depth of at least 2 inches, and you are going to interlock and place your palm on the victim's chest and push. Once you do this, you are going to open the patient's airway, you are going to give 2 rescue breaths, and you are going to repeat this. You are going to activate an emergency response. Now that you know how to properly give CPR to infants and adults, I hope when we look back at this story, you can then say, yes, I know how to perform CPR. Thank you.